Hi there, I'm Scott McKenzie, founder of Home Care Agency Blueprint. If you're thinking about starting a home care agency in Nevada, I want to give you a clear, real-world breakdown of what it takes and how to avoid the mistakes that slow most people down. Nevada requires a license for any business that provides non-medical personal care services in the home. That includes things like bathing, grooming, companionship, and help with daily living. So whether you're planning to serve private pay clients or offer Medicaid services down the line, you'll need to go through the official licensing process, and it's important to get it right from the start. Let's walk through it. Step 1 is forming your business. You'll start by registering your LLC or corporation with the Nevada Secretary of State. Next, you'll need to get your local city or county business license. In places like Las Vegas, for example, that includes an additional application fee and sometimes a home occupation permit if you're running the agency out of your home. Once your business entity is formed and registered locally, you're ready to apply for the state-level personal care agency license. This is the actual license that gives you legal permission to operate, and it's issued by the Bureau of Healthcare Quality and Compliance under the Nevada Department of Health and Human Services. The state licensing fee is currently $1,374 for new applicants. That's just the state portion. Local licensing costs are separate. Now let's talk about what you'll need to include in your licensing application. First, the basics, a completed application. Background checks for all owners and your agency administrator. A resume for your administrator showing at least 1 year of supervisory experience in a health-related field. Proof of your city or county business license, general liability insurance, and workers' comp. A surety bond, or in some cases a cash deposit or other financial security approved by the state, and a full set of customized Nevada-specific policies and procedures. That last part is where a lot of agencies run into problems. Nevada has very specific rules under NAC 449. You'll need to submit written policies that match those rules, covering everything from infection control to client rights to how you'll prevent and report abuse. We've seen many applications get delayed or denied because the policies weren't detailed enough, or they use templates from other states that don't meet Nevada's standards. That's why we build every Nevada policy set from scratch, tailored to your agency and classification. Once your application is submitted and complete, the state will schedule your initial survey. This is basically an inspection, either virtual or on-site, to make sure your agency is actually ready to operate. They'll review your systems, your files, your documentation, and confirm that your policies align with the regulations. You'll need to have an office space set up with a computer, phone, and secure storage for records. P.O. boxes are not accepted. They expect a physical address with operational capacity. If everything checks out, your license will be issued. So how long does the whole process take? Most agencies can expect the full licensing process, from application to approval, to take about 60 to 90 days. But that depends heavily on submitting a complete and correct packet. If something's missing, like a resume that doesn't meet the state standards or an outdated insurance certificate, it can add weeks or even months to your timeline. Let's talk briefly about your staff requirements. Once you're licensed, your caregivers must meet Nevada's home care aid standards. That includes at least 75 hours of training, a state background check, TB testing, CPR certification, and yearly in-service training, especially around abuse prevention and dementia care. If you ever plan to serve Medicaid clients under the state's PCS program, there's a separate enrollment process, and we guide our clients through that too. Now here are a couple of common questions we hear. Can I use a cash deposit instead of a surety bond? Yes. Nevada law allows an alternative under Assembly Bill 5119. But you have to request that specifically in your application, and it needs to meet the financial protection threshold. Do I need to have an office, or can I run my agency from home? You do need a physical address. If it's in your home, it must still meet operational standards, with a dedicated workspace, secure document storage, and a landline or business phone setup. Here's the bottom line. Getting licensed in Nevada is absolutely doable, but it's not something you want to figure out as you go. The state expects clear documentation, the right insurance and bonding, and policies that are fully aligned with Nevada law. And when you get it right, you can operate legally, attract clients with confidence, and start building a real business that creates freedom, purpose, and income on your terms. If you want to see how we help agency owners do this successfully, your next step is simple. Watch our 10-minute video walkthrough with Caroline. She'll explain how our CHCE system and Blueprint Ops platform help Nevada agency owners get licensed, compliant, and ready to serve without franchise fees or confusion. Click the link below to watch the video. And when you're ready, book a free clarity call with our team. We'll walk you through the process step by step and help you map out your launch plan. No pressure, just real support. I'm Scott McKenzie, and I'm here to help you build your Nevada home care agency the right way from day one. Let's get started.